everyone is at risk of contracting COVID-19. However, persons over the age of 60 and those persons with underlying illnesses are more likely to suffer from related critical illnesses or worse, death. The matter of identifying and protecting those members of society was discussed at the latest digital COVID-19 conversations held by the Ministry of Health and Wellness. When explaining the seriousness of the situation, Chief Medical Officer in the Ministry of Health and Wellness, Dr. Jacqueline Mackenzie, says 717 persons over the age of 60 have contracted the COVID-19 virus so far. She says that group has the highest incidence of death, with 59 fatalities.
We must protect this age group. I can subdivide that even further to say that the older you get is the more risk you face, because of the 60 to 69 age group, where we had 393 persons confirmed as positive, we had 12 deaths in that group, which represents 3% of that age group that would have had a bad outcome. While in the over 80 age group, we would have had 22 deaths in 115 persons, which represent 19%. So clearly, the numbers are really showing that the older age groups are the groups that are at risk. And so it is very, very important that we protect these persons.
The CMO says there have been 7 deaths in the 0 to 39 age group.
7 deaths, of course, every death is greeted with a lot of sympathy, and we would certainly regret that any of these persons should have died. But certainly it is showing that for the younger age groups, the risk is much less, and these persons that would have passed would have been also have comorbid illnesses.
Mrs. Mackenzie further explains that in older age groups, there are higher incidents of comorbidities like diabetes and cardiovascular diseases.
Those persons over 60, we would have seen a high incidence of those diseases. Almost every person would have had at least one of those illnesses, and many would have had 2, 3 of those illnesses.
Minister of Health and Wellness, Dr. Christopher Tufton, says health aides assigned to health centers are instructed to identify the most vulnerable.
So they would visit with these communities. They would determine who are the ones that have underlying conditions, and those records are available within their health centers. They would ensure that these persons take their medication. The National Health Fund now offers a delivery service. So for persons who can't go out, they can get that support. They would give advice on the mask wearing, not congregating, and the sanitization methods to ensure that these persons who are vulnerable are given adequate information to understand that how they operate within their surroundings will have an impact. Oftentimes we don't talk about the healthy and the strong and the young in these communities. And the truth is, while they are not vulnerable, as the evidence suggests, or as vulnerable, the truth is they can in fact transmit the virus to their grandmothers and their mothers and the older, more vulnerable population.
The Chief Medical Officer ended her address by reiterating the sentiment that living with COVID-19 is a notion that's to be taken seriously.
Living with COVID means that everybody is vulnerable to catching COVID, and therefore you have to protect yourself at all times. It also means, we have spent the time here today showing how vulnerable the elderly persons are, how vulnerable the persons with chronic diseases are. So it also means that there must be a recognition in your families, in your communities. You have to take responsibility for your family members who have chronic illnesses, who are elderly. You also have to take responsibility for your communities, persons who are elderly and who have comorbid illnesses. These persons need to be protected. Living with COVID means that you need to protect yourself at all times and you need to protect the vulnerable in the population. It does not mean life as usual.
Get into the habit of washing your hands frequently with soap and water for at least 20 seconds. Cover your nose and mouth when coughing or sneezing. Avoid close contact with people who are sick and wear a mask in public.